What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. As always, I am your host, Dr. Meghna Dassani. Today I have Dr. Nimisha Somaiya, who practices in Ohio. Dr. Somaiya is very unique in the fact that she's a general dentist, just as I am. A large portion of her practice is focused on wellness for her patients, including treatment of sleep. And it also helps that we've known each other since our dental school days back home in India. So we've been through dental school twice. So we're soul sisters in the true sense of the word. So without further ado, welcome, Nimisha.
Thank you. Thank you, Meghna. Thank you for having me on this podcast this morning. It's so good to see you today.
Likewise, it's always a pleasure to see you. And as always, we have so much to chat about. So, without further ado, I'm going to jump right in. Your journey into sleep is very similar to mine, although thankfully you haven't lost a family member. But there is a very personal connection as to why you got into sleep and what that has been like. Share that with our listeners because I know that there's somebody out there that's going to go, oh my gosh, this is insert, a loved one. So share that journey with us. What got you into the world of sleep?
So back in 2006, 2007 timeframe, my husband was having a couple health challenges, hypertension, headaches, and something told the doctor that he needed to send him for a sleep study. So back then he went to the lab and had a sleep study done, and lo and behold, he was diagnosed with sleep apnea, given a CPAP to try at home. At that point, we were married for a couple of years. How bulky the CPAP could be. It wasn't convenient. He had a full face mask. He couldn't get used to it. So it sat on the nightstand, gathered dust. Nobody explained to us how detrimental sleep apnea could be. So we didn't think twice if he wasn't using it and went on about our lives. In 2013, I had a brand new practice and I'm always looking to grow my skill set. So I get this information in mail about a course for dentists, how to make oral appliances for sleep apnea patients. So since I knew somebody dear to me with sleep apnea, I decided to take this course. Well, I'm sitting in this 2-day course and I have all these light bulb moments, everything going off, because that's when I truly learned that, oh my gosh, sleep apnea is a life-threatening disease. And there are so many other health issues which are connected to somebody having untreated sleep apnea. And as I'm sitting through the course, they go into talking about children and signs of undiagnosed or sleep disorder breathing in kids. And I had a 4-year-old at that time. And I am like, holy moly, he fits all these the bill. He fits the bill. He had the snoring. You didn't even have to turn back and look at him in the car. You knew he was asleep. He was snoring. You could hear him in the other room. He was grinding his teeth. So that's when I was like, we need to do something about this. So that's kind of what got me serious about getting my husband and my son help. At the course, there was Airway-Focused orthodontist who's Dr. Deers. He was about 45 minutes from my practice, and all three of us ended up in his office for a consultation. So the first thing he recommended is, my son, whose tonsils were touching, we get those removed. My husband had enlarged tonsils, so we got both of them in the same week, got their tonsils removed. Just imagine that. Over
You are a
Christmas
brave
break.
woman.
I know, right? It was easier to manage my son than my husband, but we got through it. We got through it. And after that, we did early expansion for my son because, his jaws were not growing as they needed to. So Dr. Deere got him into expanders. And then as a teen, he was back in braces to finish it up so that he wouldn't have the same challenges my husband had and hopefully lower the risk of him developing sleep apnea. The moment we got his tonsils removed and him expanded, he was a different child. He sleeps like you can't even find him under his blankets. He sleeps so still. My husband went through braces. We moved his teeth into better positions to create a little bit more room for his tongue. He wore an appliance for a few years, but I think back in 2020, he was willing to give the CPAP a try again. So got onto the CPAP, and it's made a world of difference for him. I mean, he won't even take a nap without it. And the quality of sleep, his health, everything is so much on the right track. So as if the two of them were not enough, I was like, great, this is awesome. Life is all nice. I was really hoping back then that I would start um, offering the service to my patients. But you know how it is. You're a mom of a young child with a brand new practice, and the stressors of life took over. So treating patients got put back on the back burner um, till you and I reconnected back in 2018 when I came to your course. You sent us to the hotel room with a take-home sleep study, and guess who had sleep apnea? Hello. It was, yeah, right, family. Um, so back then it was mild. I didn't think twice about it, and but I came back with a reignited passion. I started making more of an effort, having the conversations with my patient. I got a sleep study to send home with my patients, myself, and kind of slowly started dabbling into it. Didn't really, have much success. Patients would look at me like I had two heads, or why the heck am I talking about? But I kept pushing through it. And finally, I made the first sleep appliance for my patient, and what a world of difference it made in their life. So, wow, this is so true. Well, a few months back, I was really, really struggling all day long. I had no energy, come home, need a cup of coffee, take a nap. So I decided it was time to practice what I preach, and made myself an appliance. And that has really made me realize how important it is. Till I put an appliance in my mouth, until I found the benefits, it was more of, okay, you know what, I want to help you, but now I have a personal story to share where I can be like, listen, this really works. I show them my appliance, share my struggles with them. So that's, the condensed version of the last 12 plus years of my sleep apnea journey.
That's amazing, though. So many, and thank you for sharing that. It's not easy to put yourself and make yourself vulnerable, but there were so many great points that I want to make sure I touch upon. When you said patients started to look at you like you had two heads, right? Because even to date, for as long as you and I have been integrating sleep apnea treatments into our practices, a lot of patients still think all a dentist does is check for cavities and look at your gums. And when we start to bring up sleep apnea and how they're sleeping and whether they're snoring, they're like, wait, like what is going on? So I completely understand that battle. What does that look like in your practice as to like have you screen patients and what that conversation goes? So let's assume that I'm a new patient in your practice or even an existing patient that hasn't seen you for many years. What does that screening process look like? What are the signs and symptoms that you're evaluating?
So one of the things we do have is a sleep questionnaire as our patient forms. Whether you're a new patient or an existing patient, once a year we give you a sleep questionnaire. I don't completely rely on that form. It is a good conversation starter, but what I find is sometimes patients are just in a hurry. They just sign. They don't really check, the boxes, or they don't really pay attention to. But it at least gives me a good point to bring up. But mainly, I'm going by clinical signs and symptoms. What I'm looking for is if they have tonsils. If they have tonsils, how enlarged are the tonsils? Do they have enough? If I ask them to stick their tongue out, can I see down their back of their throat, or is the tongue almost touching to the roof of their mouth? The other signs I look for is how large is the tongue? Is it covering the surfaces of the other teeth? Is it a scalloped tongue? Is there a tongue tie? You will be surprised how many patients, when I bring up the tongue tie, they're like, I was never told that I have a tongue tie, or no wonder I couldn't stick my, touch my nose with my tongue. So those are just the tongue in the tonsils, the soft tissues. The other thing is like, how crowded are the teeth? Are the teeth, the molars kind of lingually inclined? If they're not upright, they're taking away the space from the tongue. So it's almost, I'm looking for, does the tongue fit in the box? Because that, when we lay back, the jaw falls back. And if the tongue doesn't have any room, it's going to fall back and crowd the airway. So those are the main signs I'm looking for. If there's wear, if there's that shows the signs of clenching and grinding, there could be little notches by the gum line, what we call fractions. So in adults, when I start seeing multiple signs, I start asking them questions. Hey, are you aware if you snore? Are you clenching and grinding? Or have you been, ever treated for screened for sleep apnea? Those are the clinical signs and symptoms. Of course, there are enough on the health history. If somebody has on multiple medications for blood pressure, has diabetes, hypothyroidism, high cholesterol, all those conditions, even good. So if they have multiple conditions on their health history and I'm seeing these clinical signs and symptoms, I'm having that conversation with them. With kids, we are looking for how the arches are developing, how the same thing, the tongue tie, and if the kid is sitting still or is moving all over the place. So then I'll start asking parents the questions: how do they sleep? Would you share a bed with them? So it's more of what we're observing, the clinical signs, having the conversation, and based on that, I'll talk to the patient. Hey, listen, this is what I'm noticing. What do you feel a certain way? And it's interesting how often patients will be like, yeah, I was told I need to get a sleep study and I have ignored it. Or, yeah, my wife says I snore. Actually, the other day I had a patient first thing in the morning and she was really tired. We start early, 7 o'clock, and I'm like, doing filling some. She is just too tired for 7 o'clock. So I'm like, hey, have you ever been screened for sleep apnea? And she's like, actually, I'm supposed to get a sleep study and I've been ignoring it. So that's, how we screen, how we start the conversations.
Yeah, and I love that because, like you mentioned when you were sharing your story, a lot of times patients don't know why it's important. They're just told, right? Go get a sleep study. Nobody takes the time to explain what the implications are. Say you do have sleep apnea. What is happening? Why is it important? Is it impacting your blood pressure? Is it putting you at a greater risk for heart attack or stroke? They think it's like, oh, go get blood work, that kind of.
Mm-hmm.
So I love that as dentists, we are taking this upon us to help screen our patients because everything that you just discussed is we're connecting the dots, right? We're
Exactly.
looking at the patient, at their health history. We're looking at what we're seeing in the mouth. We're looking at the conversations that we are having with them and then connecting the dots to build a picture which tells us, like you said, hey, you're way too tired for, I know it's
Mm-hmm.
early, but it's not that early. Let's go, talk about a sleep study. So I love that. You mentioned something about aligning the teeth, and I think you said your husband ended up with braces, and you mentioned about there not being enough room for the tongue because of the position of the teeth. Now, I know you do a fair bit of Invisalign for your,
Mm-hmm.
is that correct? And you're
That
highly
is correct.
trained. How does that fit into the whole sleep apnea picture? I mean, yes, that head is connected to the rest of the body, believe it or not. What? But how does treating is there a connection in how you combine the two for your patients?
Yeah, so a lot of times patients, like I didn't know how detrimental sleep apnea was. So a lot of times when we bring up, the crowding of the teeth with the patients think that, oh, I'm X number of years old. I have lived with these teeth all my life. I don't need to worry about straightening the teeth. So, what I'm looking for when I am looking at the teeth is I'm looking at how they are positioned, not just in the front, but at the back as well. Because if the teeth are inclined and the tongue is scalloped, there's not enough room for the for the tongue. So that's when I explain to the patients that, what, I'm not even so focused on straightening the teeth. It's in giving you a beautiful smile. That's a nice side effect of what I'm trying to accomplish. But when we put the teeth, if they're inclined and we put them in a upright position, or the upper teeth, we kind of move them out of the way and expand the teeth, like the arches, by moving the teeth, kind of, we're giving the tongue more room. And the tongue, if it is not crowded in the box, then when you lay back, since it has more room, it doesn't have to fall back and crowd the airway. So when I am recommending Invisalign, I'm really looking at how can I create more room for the tongue? Can I create enough room for the tongue to rest on the roof of the mouth? So that's where we start the conversation with Invisalign. Even when I'm treatment planning the case, I'm straightening it and giving them a perfect result or almost perfect result is the last thing I look for. I'm like, how much room can I gain? And sometimes, the 2 or 3 millimeter of space you can gain makes a big difference, Same thing, we can do early expansion on kids and help grow the arches. We are, with adults, we kind of can't take advantage of the growth spurts, but with the kids, we can take advantage of the growth spurts. So that's where we are really focused on with Invisalign, not just straightening your teeth, kind of giving you a nice, beautiful smile, but really giving you your tongue space and helping you be able to breathe.
I love that. I love that, for those that are listening, I think it's important to take note of the fact that what they're looking at, what Dr. Somaiya is looking at, is more functional, giving the tongue the space, because remember, the tongue needs to be resting passively in the roof of the mouth, right? Ideal oral resting posture
Mm-hmm.
is lips together, breathing through the nose, and the tongue having the space to be able to rest in the roof of the mouth. So you are approaching this from a functional perspective. And
Exactly.
I love that you said, oh, it's a nice side effect that you get straight teeth and a beautiful smile. I absolutely love that because unfortunately, a lot of people think a beautiful smile, it's important, but that's all that there is. So I'm impressed. And how has this changed your practice? How you approach things, even just adding sleep to your practice. How has this changed your life, the life of your patients, and just impacted everything that you do?
So, like I said, early on, I didn't realize how critical it was, and my life take over till I saw the difference in my husband, my son. But it made the biggest difference when I started wearing the appliance. You know, already shared, like when I would talk to patients, they would look at me like I had two heads, or like, why are you talking about this, or why do I need to fill out the sleep questionnaire? I mean, there have been patients who are like, I don't think it's important to discuss my sleep with you, so I'm not going to fill out the questionnaire. And I'm like, that's fine. I respect that. They just think that, just clean my teeth and let me get the heck out of here. So it was hard not to get discouraged, but, then I have that patient who I discussed the sleep, the signs and symptoms, and they listened and they went and talked to their physician and they decided to get the sleep study. And 6 months later, I see them and it's a new person. And I'm like, what happened to you? He's like, well, I got my sleep study. Guess what? I have sleep apnea. Now I'm on a CPAP and I feel the best I've ever felt. Or when the patient who said, I did not want to wear a CPAP and I want to help, so I will let you make my appliance, walks in all smiling with like a different person off of their blood pressure medication. That keeps me going. I can even tell you so many times, when I'm having the conversation with the patient and they'll be like, can I ask you something about my kid? I'm like, sure. I've not seen the kid, but they're connecting the dots along with me. And they're like, okay, I am going to go, be my kid's advocate. And, I had a mom come in the other day. She's like, my 14-year-old, we got a sleep study, got his tonsils out. He stopped bedwetting. Or the mom who comes and says, my daughter's off my asthma medication. Even though I've never seen the doctor, I'm celebrating with them. So it keeps me going. So as far as, how it's changed my life, even my team has noticed that I'm full of energy during the day. I am able to do things I really want to do with my son after work because I'm not tired. Oh no, I need to take a nap. But just being able to make a difference in people's life has been so satisfying and so rewarding because it's like, a lot of times we think, oh, we go in and, clean and brush and floss people's teeth or drill and fill teeth. But no, we are actually capable of making a difference in people's life. We're not just telling them to floss their teeth or do filling. We are actually helping them breathe. So that's where it's kept my going. And now that my team is actually seeing some of the patients and hearing their stories, they are getting more enthusiastic about it too. So it's hard to kind of put in words the difference it's made for me just as a healthcare provider.
Love it. I absolutely love it. And I think your family is a prime example of how there is no one size fits all for treatment, right? Yes, CPAP is the gold standard, and I love that. Your husband is able to tolerate it and he feels a difference with it. But then we also have a child that benefited from expansion, early
Mm-hmm.
expansion. And we also have you who is absolutely rocking your sleep appliance. So there is no one size fits all, which is why providers like you are so important in our communities, just so our patients know that there are all sorts of options that can work. You just need to be willing to, and able to have that conversation, go into your appointments, yes, even your dental appointments with an open mind, because when we have highly trained dentists, it certainly can make a difference. Love it. Um, Moving on to, you have a very fun social media page. I am a huge fan. For the record, Facebook recently said I am a top fan of your practice because I'm
Thank you.
constantly like looking out for posts. Share with our listeners, how can they find you? By the way, if y'all aren't, you should be following her social media pages. We will post her links in the show notes, but share where people can find you, how they can connect with you and your team.
Absolutely. So I cannot take full credit for the fun page. Abby, our front office administrator, like a coordinator, she has that fun personality, and since she took over the social media, it's a lot of fun. So, and the team, plays along with her. So I will give all the credit to Abby for that. At the same time, you can find us on both on Facebook and at Seva Dental, as well as Instagram. Seva Dental just as the practice, SEVADENTL. And then I will make sure to share with Abby how you are a top fan.
Yes, for sure. Um, just from the name of your practice, and I think it embodies you and your purpose and what you do. Share with our listeners how did the name come about?
Oh man. So, 12 years ago, or actually not 12 years ago, back in 2011, I decided that it was time to be my own boss. I'd worked for other doctors and, I knew what I wanted to do and what I didn't want to do. So I started the search for buying a practice. And when that didn't come along, nothing felt right. I decided to do start a startup and, hang the shingles, start from scratch, took an empty shell and turned into the practice it is today. Um, so then, when you're starting from scratch, you have to think about the name of the practice, and nothing felt right. Nothing felt right. And one day I kept thinking, dropping off my son to daycare. He was 2 years old back then. I'm like, how do I name this practice? I didn't want to call it the town I practiced in because there were like three other practices with the name of the town, like Bellbrook in it. So I wanted to stand apart. And I kept thinking, I'm like, who am I? What do I do? And I was like, well, I am in here to serve patients. And being, from India, I was like, how do we serve patients? What does that mean? And the word Seva popped into my mind. Seva means service in our native language. You're very well aware of it. So that's how the name came. And the more I talked about it, the more it resonated with me. So there it is. Seva Dental was born that way, and that is truly what we stand by. Even our tagline is service first. The first thing, we are all about customer service. Patient care is part of the customer service, but the goal for my team and me is like anybody who interacts with us, whether you call us, whether walking through the door, whether you're out in the community living your personal life, you have to embody service, and that's who we are. So that's the story behind Seva Dental.
Love it, love it. You are leading and serving from the heart. And knowing what I know about you, your practice, I think you perfectly embody it. So if anybody that's listening in, if you or you have a loved one that is in, you said Bellbrook, is that correct?
Hmm.
In that part of Ohio, I honestly believe a conversation with Dr. Somaiya and her team is something you should consider. Are y'all accepting new patients? I know you're fairly busy.
Yes, absolutely, absolutely. We are accepting new patients. At the same time, you know what? Even if you have questions, like I said, we have had patients. We are talking to them about their health, and we start talking to them about their kids who are not even patients of ours, and they're getting the help they need. Our goal is to spread the message. So if you are listening to this and you are, you know, in the surrounding Bellbrook area, at Centralville, Bellbrook, Springboro. We're all a very tight knit community. And you're like, huh, could this be me? Pick up the phone, come, let's just have a conversation because you do not want to ignore sleep apnea. I mean, thank God I have not lost a loved one, but me now you lost a loved one. And if they would have received the treatment they deserved back then, they would still be around. So there are enough people who lose their life to sleep apnea. So if there are any, even if you're in doubt that should I get a sleep study, come, let's have a conversation. We can send you home with a sleep study. We can point you in the right direction, but don't ignore it. Don't ignore it.
Love it, love it. I certainly think that offer is worth taking up on. As we wrap up today's episode, I always end our episodes with this, so we will ask you as well. What are your top three tips for patients, parents? They may or may not be related to sleep apnea. I'm hoping there's at least one that's related to sleep. But what are your top three tips for anyone that's listening?
So the biggest thing with, gosh, just three. All right. So my top tip would be for parents. If your child is snoring, if your child is grinding, if your child is hyperactive, do not ignore those signs. It is not normal for kids to grind. It's not normal for kids to snore. Uh, Kids are not going to outgrow the grinding. There is a reason they are grinding. Their body is trying to keep them alive. So if that's happening, please have a conversation, either with a pediatrician. If you don't get the answers you need, keep fighting for it. Dr. Dassani has a great book, The Tired Child. I know I handed out to my patients in the practice that way. If you resonate with any of those, fight for the answers. The second thing is if you have a sleep apnea diagnosis, please do not ignore it. You don't want to stop breathing in the middle of the night and never wake up. So if you have a diagnosis and you cannot tolerate the CPAP, there are other alternatives. There are other alternatives for mild and moderate. The appliance works just as well. So please, there are several of us in the area who can help you. Please do not ignore it. And if the doctor doesn't listen to you, find a different doctor. I can't even tell you how many times I have had a patient come back and said, my doctor's not worried. They just said lose 30 pounds. That's all I'm going to say. I mean, there are great
So you're
practitioners out
having a hard
there.
time losing those 30 pounds?
Hmm.
You're too tired to work out, but
Exactly.
yes. Awesome. Well, thank you so much for taking the time. I know you probably felt like I was pulling teeth when I wrangled you into being a guest, but you bring so much value to not just our show, but to the people around you and in your life. And I can say this because I've known you for a very long time. So thank you so much for all that you do. Thank you for being on our show. And if you are listening, you know the drill. Share this episode. If you have a loved one or someone that you know that lives in the neighborhood that could benefit from a conversation with Dr. Somaiya, you know where to send them. All right, everybody. I will see you next time. Thank you, Nimisha.